So my name is Archana, Sunil. I'm here to talk about the basics of Medicare. And I live in Seattle. I'm licensed in the state of Washington and recently got licensed here in Massachusetts because my friends here encouraged me to bring my knowledge to this side of the coast and share it. So I said, why not? And I brought the rain with me. You're welcome.
Thank you. You take the snow back with you.
I don't want the snow. So what we'll do is, and I've been doing this 5 years. I'm a broker in the state of Washington and same here in Massachusetts, so I'm contracted with quite a few companies, and that's what I do. But today we're not going to talk about any specific company. We're going to talk about just the very basics of Medicare. How many of you are in Medicare, how many of you are in Medicare? Already in. So the rest of you are still headed in that direction. Okay, got it. All right, so we will begin with what is Medicare. Medicare is a federal program, and it's age-based, not to confuse it with Medicaid, which is income-based. Medicare is age-based, and there's a couple of ways you can qualify for it, and we'll go through all those stages in just a quick second. Yeah. Okay. The eligibility is you either turn 60, you're either 65 years old, or you're under 65 and you've been on disability for 48 months. So 2 years on Social Security disability. So those two qualify you or make you eligible for Medicare. You can also be eligible for Medicare if you're over 65, you were still employed and covered by your employer's coverage, and that ended. And that also qualifies you for Medicare. So you don't have to sign up while you're employed, and you do have coverage. And as far as immigrants are concerned, they would have to have been a legal resident for 5 years before they can become eligible for Medicare. And we'll just look at that in a second. If you're collecting Social Security or yes?
So do they, immigrants means, can they be on H-1 visa?
No. Well, yes, so legal residents. So have to have been a legal resident for 5 years. You don't have to become a citizen, but you have to have been a legal resident for 5 years. Green card. Yes, green card, correct, for 5 years. And that makes you eligible for Medicare. But the way they qualify for Part A, Part B is different because they've not paid into the taxes. So the way they get into A and B is different, especially A is different than the regular path. And I'll talk about that briefly too. And Medicare is an individual program. So it's unlike Obamacare or the under 65, it's not the whole family or both the spouses together in one plan. Everyone's individual. And so you could have two husband and wife, totally different plans, and that's totally fine. If you're collecting Social Security at the time of retirement, you'll automatically, when you turn 65, automatically get enrolled in A and B. And then if you want to stay employed, you just opt out of Part B. There's a form you fill out, and you just opt out of Part B temporarily. If you're not collecting Social Security when you turn 65, then you go into Medicare.gov and you apply. And it takes 10 minutes. They just want your demographic information, and within 7 to 10 days, you get your card, your red, white, and blue card. There are many periods throughout the year when you can enroll for the first time, is of course when you turn 65. So the month you turn 65, you can enroll in Medicare up to 3 months prior to that and 3 months after that. So you have a total of 7 months to enroll in Medicare. Original Medicare. If you miss that deadline, that 7-month period, you can then enroll the following January 1st to March 30th. That's called the general enrollment period. However, if that happens, your Medicare will not be effective until July 1st of that year. I'm going to let that sink in. So you either enroll in original Medicare A and B 3 months before you turn 65, or the month you turn 65, or 3 months after, within that 7-month window. And if you miss that deadline, you can still do it the following January through March during the general enrollment period, but that will not be effective till July 1st. So essentially, you'll still be uncovered till July 1st. I'm sorry, without coverage, not uncovered. Make sense? Yeah? Okay. So we talked about all that. And once you're in a plan, whether it's Medicare Advantage or this is the open enrollment, yes.
If a legal resident, immigrant resident,
Right.
After 5 years, already over 65.
Yes.
So for him or her, the position is that enter between January and March.
No. So when the date that you finish your 5 years on your green card, that opens up a special enrollment period for you. So you see the last bullet there, moving into a new area and all that stuff. What I didn't mention there, and I should have mentioned, is that the day you've completed the 5 years, that's considered a life event. And so from that day on, you have a 60-day special enrollment period.
Okay.
You don't have to wait till next January. So you would start calling Social Security about a month before you finish the 5 years and let them know that I'm hitting that point, what do I need to do? And they'll walk you through the process. So there's original Medicare, the federal Medicare program, consists of Part A and Part B, okay? Part A, think of it as the building, the hospital. Any kind of expense, medical expense that you incur due to a hospitalization, Part A will pick that up. Okay? Now, Part A, if you've paid into the Social Security system through your taxes for at least 10 years or 40 quarters, is premium free.
Only into the Social Security system.
Oh, so which includes the Medicare.
No,
No,
if you're a state employee, you don't pay into the Social Security.
Oh, okay, I don't know about
You
that.
pay into the
retirement,
retirement.
so they don't get that. So, okay, so I'm just.
I have to research that. Good question. Okay, I have to research that. But yeah, as long as you've paid your taxes towards Medicare for 10 years or 40 consecutive quarters, your Part A is premium free. Now, for immigrant situations where you have not paid into the system, you can purchase Part A, and it's about $430 per month. They can't be charging you that. No.
You're charging some money to be.
Well, that's probably something else. So yeah, so you've paid into the system. Part A is premium free. If you've not paid into the system, you can purchase you're eligible for it, but you don't qualify for the premium free, so you can purchase it for about $430, something like that per month. Part A comes with a deductible. The current deductible for Part A is $1,364. Yeah. Yeah, and that's not per year. For Part A, the benefit period is 60 days. So every time, I'm going to say this very slowly, it has many parts to it. So every time you go into a hospital for an unrelated event that is separated by 60 days, get it, the 3 parts? You owe that deductible, $1,360. Yeah, so it's not so the Part A deductible is not an annual deductible, it's for a 60-day benefit period. But for that 60-day benefit period, once you've paid the deductible, then you're covered 100% for the remaining of that benefit period.
Meaning you have to fall sick within the 60 days.
You have to fall sick and get out of sickness within 60 days.
Yeah. So that's a number to keep in mind, 1,364, when it comes to original Medicare Part A.
What constitutes a similar diagnosis versus a new condition?
That's a medical decision. Yeah.
I mean, do you know? Like, should you think about that?
You should, and that's really a decision that the provider will. Yeah. It's how they code it, how they bill it, what they diagnose. So that's Part A. Okay. Now coming to Part B, we saw that Part A was all hospital insurance, everything that happens inside a hospital. Part B is outside of the hospital, so your doctor visits, your specialist visits, x-rays, labs, some drugs such as chemotherapy drugs, infusions, injections. So a lot of the stuff that happens in a doctor office kind of setup is Part B. And Part B, the premium for Part B depends on your income. For the most part, the premium for 2019 is $135. Correct. For the most part, it's $135.50 per month. This is for Part B. I do have some clients. Please come. Please grab a book. Here. I do have some clients who pay $400 per month for Part B because what Social Security does is they go back 2 years to look at your income from 2 years ago. So even though you're retired now and you don't have income right now, for the first couple of years, your premium for Part B will go off of what you earned 2 years ago and from then on. So every year they reassess your Part B premium going back 2 years. Yes?
One question. On the previous slide, it said something about you can go to any hospital that accepts Medicare.
Yes.
All hospitals accept Medicare?
Yeah, for the most part. Yeah. Yes.
Can I also ask, if you travel to Canada, will they accept it?
No, this is all in the United States.
Just US?
Just the US, yeah.
So we should
Medicare
buy-
does not cover international.
We should buy Canada.
So Part B is about $135.50 per month for 2019, and all these numbers get revised every year. This is the most current number.
So the 135 is the bare minimum, everybody.
Everybody will pay this Part B. And Part B also has a deductible, just like Part A. The difference being, this deductible is an annual deductible. Okay, and that is, right now, it's $185 for the whole year. Yes.
Again, going back to the income,
Yes.
is it graduated? Do they have steps?
Yes, they do. Yeah.
How many are there?
There are about 5 or 6 based on your income when you file your taxes, whether you file it single, whether you file it joint. So based on that, they have slabs. And yes, so that's what it's based off of.
And what's the max?
Of maximum premium,
Yeah.
The extra you have to pay.
it's called IRMA, income related. I've seen people pay $400, $450 per month. I mean, I have folks paying that. And there's no way you can, no way to work around that. That's just their income, yeah. Yeah, and once you meet this deductible, $185 for the year, after that it's an 80-20 split between you and Medicare. Medicare will pay 80% of everything, you'll pay 20% of everything. Part B,
After the deductible.
after the deductible. So I'm just going to, yeah,
Any bill above $185, we're gonna pay 80-20?
yes, exactly.
Then
Yes. The thing with A and B is that there is no, especially with B, there is no upper limit on where your out-of-pocket stops. If you have a big event, incident, and your bills are $100,000, $200,000, it's going to be 20% of whatever that is. There's no maximum out-of-pocket. So that's one of the things to keep in mind when deciding what to do with all these out-of-pocket expenses. Is how do you cut your risk down? Because there is no cap.
Okay, but you said that once you go to the hospital, I mean, you don't pay bills for 100,000 going to a doctor's visit.
No, I'm talking, this is only Part B.
Okay.
Part B, there's no upper limit on 20%. It can go on and on and on, and there is no upper limit. Part A, you're right. You pay the deductible and you're done for that benefit, the 60-day benefit period. After that, Medicare pays 100%. Here, after you've met the deductible, Medicare pays 80%. So that's the difference between A and B. Does that make sense?
Yeah.
Yeah? Okay. Again, just like A, you can go to any doctor in the US with original Medicare that is contracted with Medicare. And most hospitals like, Carolyn, right?
Carolyn, yeah.
So like you mentioned, most hospitals, to my knowledge, are contracted with Medicare. But providers have a choice whether they want to accept Medicare or not because of the pay rates and all that stuff. So not every doctor takes Medicare. All right, Part D. So we saw A, we saw B, and that's where original Medicare ends. So as you can see, there is no prescription coverage, no dental, no vision, nothing, just medical care. So that's what you get with the federal program. And so the next step then is what do you do about prescription plans? So they're called D's drugs, Part D, and these are sold by Medicare-approved private insurance companies. The Humanas, the United Healthcares, the Aetnas, you name it. And they're all required to meet certain minimum standards. They're required by Medicare to meet certain minimum standards, and I'll go over those. You can get Part D one of two ways. You can either get it as a standalone prescription drug plan, that's it, by itself, or you can get it as part of what we're going to talk about in a minute, as part of a Medicare Advantage plan. Okay? Now let's go back to this side where we spoke about prescription plan as a standalone plan. So you have A, you have B, and now you're going to get a prescription plan. Another thing you can do with this combination is you get A, you get B, you get your prescriptions. You can also get what's called a Medicare supplement insurance. And these range in letters A to N, and I'll tell you in a second how they differ. But Part D whether you get it as a standalone or as the alternative, they all have their own formularies. Each health plan has their own formulary of drugs that they cover. And within each formulary, they have tiers. So drugs fall under Tier 1 or Tier 2 or Tier 3 or Tier 4, and some plans even have a 5th tier. And what it is a preferred generic is Tier 1. Generic is Tier 2, preferred brand is Tier 3. And what do I mean by preferred? Is these health plans have contracts with certain, like say, what is the pharmacy here? CVS, right? So United Healthcare may have a contract with CVS as a preferred pharmacy. So if you go to CVS, your atorvastatin may be a Tier 1 drug through that plan. However, Humana may not have CVS in the preferred status. So if you did I'm just giving you an example, this is not real stuff. The same atorvastatin drug may be a Tier 2 or a Tier 3 with Humana. So it's important to, when you meet somebody like me, sit down with them, share all your drugs with them, drugs, dosage, frequency, so they can research which drug plan makes the most sense for your combination of drugs. Because the tiers vary from plan to plan. You can't assume,
And the pricing varies?
and therefore the pricing varies. Because if you have, United Healthcare has atorvastatin on Tier 1, you'll pay maybe a $1 or $2 copay for it. But if you purchase Humana, for example, again, I'm just giving you an example, atorvastatin is now a Tier 2 drug, you'll pay a $5 copay. So your copays will vary depending on which tier that plan puts that drug on. And which tier they put a specific drug on is based off of the contracts they each have with all the different companies. Yes?
So I'm curious, because if you're taking a drug that the brand, not the generic,
Yes.
is medically necessary,
Yeah.
written by the doctor, will they cover that?
It'll be covered as part of the brand copay, but there's something called step therapy, and Joanji can probably attest to that, is where the doctor and the patient decide to try a generic drug, see if it works first with the approval of the insurance, and then if it doesn't work, if it has to be a brand name drug, then that is something you can work out with the insurance company. Yeah. At that point, it becomes, I think they go into other ways of managing prescriptions. So Part D.
So,
Yes.
I'm not taking any drugs now, but I'm definitely going to take drugs after 5 or 10 years. I don't know which drug it's going to be.
Right.
So how do I know where to put my money?
Well, like I said, that just reminded me. So I'll tell you in a second. If you don't do your Part A and Part B, you choose not to do Part B when you first become eligible for it, then there is a penalty that gets added on when you later on enroll in Part B. It's a 10% penalty, and that penalty is permanent. Similarly, there is a penalty for not enrolling in Part D when you're first eligible. And you're first eligible for Part D when you're eligible for Part either A or B. And it's okay. It's not I'm not encouraging you to not enroll in a Part D. It's your choice, of course. But there is a penalty for it, and then the penalty is 1% of the monthly premium of the standard drug for that year. That 1% amount gets added on to whichever plan you sign up with. So let's say you didn't have Part D for 12 months when you should have had it. Okay? And the standard plan for that year cost $20 a month. So what's 1% of 20? 20 cents. So the next year when you enroll in a drug plan, let's say that drug plan, the premium is $25. You'll pay the $25 plus the 20 cents per month. And that penalty will stay for the rest of your life. So the penalties never go away. But again,
Who made these rules?
not me. I certainly didn't do it.
For life?
Yeah. However, you do have to do the math and see, 1% of the premium adding on to your actual premium, do you want to just postpone it? It is a risk you're taking when you don't have a prescription plan.
There's a premium for Part D also.
Yes. So Part A is premium free for most. There's a premium for Part B. There's a premium for Part D. Now, we saw the deductible, right? The Part A deductible for a 60-day period. Then we saw that Part B has 20% out-of-pocket expense and the deductible. What do you do about all this stuff? This is when you get into Medicare Supplement versus Medicare Advantage plans. Okay.
Before we get into that.
Yes.
To go back to the signing up for B.
Signing up for B. Okay.
Right.
Yeah.
No, B/D.
Yeah.
The use case here is person's working,
Yes.
right? They've signed up for A,
Okay.
but they're not using it because they have insurance through their own company.
That's fine.
Right.
Okay.
Now, they retire. They
Okay.
say, we're going to retire.
Okay.
What's the time limit before they get on to B without taking that penalty? So if you say, I'm going to retire on July 1st,
Okay.
at what point in time do you have to be signed up on B so you do not incur that penalty for life about not using B?
Within 60 days of that employer coverage ending. That's your special enrollment period.
Can you do it before? Or do you have to do it?
You do it within 60 days. You could do it before and have it effective the day after your coverage ends. And I've done that for folks, yeah. It comes down to the coverage effective date.
Right, but the key to this was to get it in on time so you don't incur this lifetime penalty.
Exactly, yeah. And as a follow-up to that, you don't want to go without Part D for more than 63 days after your employer coverage has ended. If you're coming out of an employer coverage, say it ended today, you can go up to 63 days without enrolling in a Part D plan without incurring a penalty. Part D. And when you come out of your employer coverage plan, you're already past 65, I'm assuming, you're retiring later. You want to make sure that the prescription plan that you were on is considered to be creditable coverage as per Medicare, and your HR or your employer will be able to tell you whether it's creditable coverage or not. Because if it's not creditable coverage, then you're slapped with the penalty, and you didn't even know that. So as soon as you become Medicare age 65, one of the things, and you have employer coverage that you intend to continue on and retire later, make sure that the prescription coverage is considered creditable by Medicare, and you can ask your company employer, they'll know.
So what does that mean? Is that like
It has to meet certain minimum standards as set by CMS.
So if you have like so-called Cadillac plan, you're good. But if you have like a really terrible plan,
Yeah.
you're not.
I mean, I'm yet to run into an employer or a client whose employer doesn't have a creditable coverage. But this is just something to keep in your mind, to be sure that your coverage is considered creditable. There's so much information, I'm sorry if I keep deviating back and forth, but just stop me every now and then and I'll come back to it. Are we ready to move on to the supplement? Any other questions so far?
So you said Part D, you have to enroll at the same time as A and B?
Correct. Not A and B, B. Okay. So to get Part D, you have to have either A or B. You don't need both. You can enroll in a Part D plan if you just have A and you've just decided to defer Part B because you're employed still and you have coverage.
So what's the premium for this?
For Part D, because they're sold by private insurance companies, it varies from company to company.
And co-pays too, right?
And the copays will vary based on which tier, which drug, yeah. And now going to your question about how do I pick a drug plan? Well, if you don't have any medications and you've decided to, I'm going to get a drug plan in any case just to be safe, then you just go with the cheapest plan in the market just to keep yourself covered in case you need medication. But if you do have medication, like I said, meet someone who does what I do and give them your list of drugs, have them research it for you, and they can look at it plan by plan and tell you which plan is the most suitable for your combination of drugs. Yes?
And you can change that every year.
Yes. So October 15th to December 7th, every year is called the AEP, Annual Enrollment Period. This is when Medicare folks get to switch around all their plans. Medicare Advantage back to original. You can do a bunch of combination of switches. But this is your opportunity. But this is only once you're in Medicare. And you're in what we're going to talk about, the Medicare Advantage or a supplement plan.
And you're stuck with it for a year.
For a year, yes. You're stuck with it. Yeah.
And Part D covers dental and vision?
No, D is only drugs.
So
D is only drugs. No, D is not dental. Oh, that would be nice.
So that's a separate thing.
No dental, no vision, no drugs with original Medicare.
What about the hearing aids?
No hearing aids.
So what are they covering?
Well, they do cover big hospital expenses, big events.
So what does a person on Medicare do? They get separate dental and vision?
Thanks for asking, because that's exactly where I'm headed. So shall we move on then to what do we do? Okay. Okay, but before I forget, remember I told you that all the drug plans have to meet certain standards as per CMS? These are the standards. So for 2019, none of the drug plans are allowed to charge a deductible higher than $415 for the whole year. Is that too high? Can you see? Yeah. That number for 2020 was just revised to $435. Okay? Now, not all drug plans have a deductible. And those that do, at least the ones in Washington, I'm yet to become familiar with the ones here. They say, okay, if your drug is tier 1, tier 2, we won't make you liable for the deductible, we'll just cover you right away. And so there are different, this is why you need to actually understand which plan you're looking at based on your drugs. If you have a bunch of drugs that are tier 1, tier 2, then pick a plan where tier 1, tier 2, the deductible is waived, so you don't have to meet the deductible. If you have drugs that are mostly tier 3, tier 4, like the high, very expensive drugs, you want to pick a plan that has coverage in the donut hole, and I'll talk about the donut hole in a second. So there's some thought that goes into picking the correct plan. And then the initial coverage limit. So let's say you pick a plan that does have a deductible and you've met the deductible. Once you've met the deductible, you start paying a copay, right, for your drugs. So when that total amount of what you pay for your drugs and what the insurance company pays for your drug, when a combination of those two reaches those amounts, you've fulfilled your initial coverage limit. And what that means is once you reach 3820 or 4020, you then enter what's called the donut hole. Over the last few years, what you pay for each drug in the donut hole, each type of drug, has been decreasing, and the gap between generic and brand has been narrowing down. And so in 2020, you're paying 25% for both generic and brand name drugs. This year, you're still paying 37% of the cost of your generic drug and 25% for the brand name drug. So you meet your deductible, then you meet the initial coverage limit. If you do that, that brings you into the donut hole. And once all of the amounts that you've spent out of your pocket, the deductible, the initial coverage limit, the donut hole, when all those amounts reach these amounts, that means you've reached the catastrophic stage. That's actually a good thing in a sense, because once you get to that point, your drugs will never be more expensive than these numbers.
Whatever it is.
Whatever it is. So generics are $3.40. All the others are $8.40. Generic next year will be $3.60, and the others will be $8.95.
Can you repeat that last part?
Which, the catastrophic?
No, how do you reach this stage? Catastrophic?
You reach the catastrophic if you've paid $415 out of your pocket for the deductible, then you've paid all your copays, and your insurance company has paid its part, and that reaches $38.20. Then you are in the donut hole. This is all only if you have a lot of complicated drugs. If you have one generic drug for the whole year, you'll probably not even hit the initial coverage limit. In my 5-year career, I probably have 2 folks who reach the donut hole. So it depends on the drug combination.
But the initial coverage limit is not only your copay, but
what the company pays too. So that's helpful for you. So let's say a drug costs $100, right? And your copay is $10. The insurance company is paying the remaining $90. So all of that counts towards the initial coverage limit. Yes?
Does this include drugs that you may have to take if you're hospitalized?
Yes.
So all those,
All- yeah,
all drugs
all that, yeah.
fall under this?
Yeah. And either that or the hospitalization drugs will go through Part A.
That's what I'm wondering.
Yeah.
So where do they go? They go through A or they go through B?
That's a good question. I have to look into that.
Chemotherapy? Yeah, 'cause I would-
Chemotherapy is done in the office setting, that's Part B.
Part B.
Not all of it.
Whichever is done in the office setting.
How about if it's just one that you take it out?
If you take it at home, that's Part D.
or if you take it at home.
Yeah.
it's Part D.
Only if it's an infusion in the office
Yeah, no, not infusion.
or chemotherapy in the office, that's Part B. Everything else is Part D. But I will follow up with you on the hospital drugs, who handles those. If there is a way for you to write down questions that I have to look into, or if you can remember, tell me the question at the end. Thank you. Okay. This chart clear?
Okay, when you say drug copay after the catastrophic phase is $340, that's annually or is it per
Per prescription.
prescription?
Yeah.
Not for the rest of your lifetime.
Per prescription for that year. This is all per year. So this all happens, and come January 1st of next year, you start all over again.
So let's say you're on a blood pressure medication or something for every month, and you pay $340 every month?
Correct. Yeah. And this is all for January 1st to December 31st. It kicks all over again the following year. Okay? Can you read that? Now comes the fun part. So all those out-of-pocket expenses, not leave the drug plan out. That doesn't count towards what I'm going to talk about. Let's just talk about those out-of-pocket deductibles and co-insurances and everything for Part A and Part B, right? You can get help with that in two ways. One is a Medicare supplement plan. And like I said, they range in fancy letters A all the way through N. And they cover the gaps in Medicare. For example, the $1,364 deductible for each benefit period for Part A. You have to pay that. But these supplement plans will pay that for you. Or Part B, you have to pay the $185 deductible. Some of the supplement plans will pay that for you. Or Part B, the 20% that's your expense, some of the plans will pay that for you. Now, what is the difference between all these A, B, K, L, F, and N plans is how much of this gap does each of them fill? So there's Plan F, which fills 100% of the gap. They'll pay for the Part A deductible, the Part B deductible, the Part B coinsurance, everything.
But not Part D.
No, let's leave D out of the picture for now, okay? And clearly that's why Plan F will be the most expensive Medicare supplement plan. Whether you get Plan F in Massachusetts or in Washington, the benefits are exactly the same because there is no network. You can go to any doctor that just takes plain Medicare and they will take your supplement plan. No network, so you get that flexibility of seeing any doctor in the entire country that just plain takes Medicare. You'll never see a bill because between the doctor and the insurance company, you'll never see the bill. Because the benefits of a Plan F with Premera, is there Premera in Massachusetts? No, okay. The benefits of Plan F with United Healthcare, the benefits of Plan F with Aetna or benefits of Plan F with Humana are all exactly the same. They only vary in premium.
What does that range from?
They're usually off $10 from each other.
So what are we talking about?
Oh, Plan F? Yeah, so I haven't looked at the rates in Massachusetts, but in Washington State, for example, Plan F, the cheapest is $227 a month. The next step down is, I think in Massachusetts, Plan F is called Plan 1. Yes. And the next step down is a Plan G in Washington State. Here it's called Plan 1A. And I believe that's the translation. And what Plan G does is it does exactly what F does, except the Part B deductible, which was $185 a year. So if you're willing to take on the Part B deductible, then Plan G is a good option for you. And if Plan F was $227 or something per month, Plan G is about $170, $180 per month. But that where you're willing to take on the $185 deductible. Yes?
So where do you learn about all these plans?
Medicare.gov.
Okay.
Yeah, it's the most reliable place to go.
But
You can always
but
send
it's
emails to me
state-based
too.
though, right?
I'm sorry?
Because it'll be cheaper in Florida than it is in Massachusetts.
That's what I'm saying. The benefits are exactly the same. They all vary only in premiums. Yeah.
So, but the Medicare.gov will give you the Massachusetts.
Yeah, because you'll put in your zip code and it'll tell you the ones available in your zip code. Yeah.
Will they tell you what it is in Florida or New Hampshire? Or
You'd have to put in a zip code. I mean, everything is fed off a zip code, so yeah. So Medicare.gov is a very handy-dandy website to be familiar with.
So it's applicable throughout the country.
The supplement plan, yes.
So
You,
if you apply from a zip code where the cost is the lowest,
no, you have to be living there though.
oh, yeah.
You can only purchase it where you're living, but you can use it anywhere in the country.
So
Yes.
what happens if you change states during the year?
Yeah.
That's
After one-
fine. That's totally
No,
fine.
if you move,
Oh,
so your residence moves,
if your residence moves,
will they adjust the premiums? When you have a new zip code?
let me look that up. I have not had anybody do that.
do those things.
Yeah, because I do have people who've purchased it and they travel around the country and they like the ability to go see any doctor anywhere in the country, so it's helpful. But then moving, does the supplement plan move with them or do they have to go re-sign up? Please send me an email or we'll follow up on that, yeah.
Mainly because there are some hospitals with certain specialists who are in one part of the country, and you are applied for a plan
In another part?
of the country.
That's a valid question.
You want to go to that doctor in that place.
Correct.
So that's
I mean, logically, you should be able to, but I want to double check that before I commit to it. Yeah. Also, so we spoke about no network. You can see any doctor. They're obviously more expensive because they provide you that flexibility. And they don't cover anything extra, so no prescription, no dental, no vision. So they literally just fill the gaps in between.
So you remember you mentioned the 60-day,
Yeah.
1,364.
Yeah.
That would
The
be taken
supplement
care
plans will take care of that for you, yeah.
But this amount is bigger.
Right, so we're getting to the alternative now. So this is one alternative, right? Is Medicare supplement insurance. Oh, wait, that's a blank slide. There. I'll give you a second to read through that.
So that says it doesn't cover long-term care.
It does not, correct.
What plans do cover long?
None do.
None of them?
None.
Okay,
No long. So you have to have separate long-term care plans.
I do.
Yeah, and it's a smart thing to do to get it sooner rather than later.
Yes.
But that has nothing to do with
No,
Medicare.
Medicare does not pay for long-term care. Medicare, in fact, doesn't pay for home health care unless it's medically necessary, so no custodial care. Okay, this second to last bullet, I forgot to talk about that. When do you apply or become eligible for Medicare supplement insurance? Typically within 6 months of turning 65 and enrolling in Part B. So if you're over 65 and you're still employed and you're not taking Part B yet, so you have to hold off because you have employer coverage, you don't need the supplement plan. But when you come off of your employer coverage and you enroll in Part B, and by then you're already over 65, then you become eligible for what's called guaranteed issue. So no medical questions will be asked within the first 6 months of starting Part B and being over 65. No, it's guaranteed issue. But you're in a fantastic state called Massachusetts. And apparently, I learned this morning, I met with a United broker manager. He was telling me that in the state of Massachusetts, you can get guaranteed issue Medicare supplement insurance throughout the year. I mean, anytime, not throughout, anytime. It's not just the first 6 months. In Washington State, you get it guaranteed issue, no questions asked within the first 6 months. But once that 6-month window passes, you no longer have an opportunity to enroll in a Medicare supplement insurance. But in Massachusetts, you do have the ability. So that's one big difference between the two states. I was pleasantly surprised to hear that.
Is this an option where you can say, I want it this year, but I don't want it next year? When you go through this new enrollment at the end of the year? Does this cover that, or does this stay with you forever?
The supplement?
Yeah. Is it one of these things where you pick, say you pick...
No, you obviously, it sounds to me like in Massachusetts you can switch supplement plans.
No, I'm just saying, it's like, in general though, say you're on the supplement plan, right? It comes time, now it's October, and you're saying, I'm changing my...
Supplement plan?
No, my health insurance.
Okay.
You know, say, I'm gonna go with Humana as opposed to Aetna.
In terms of the supplement plan. So you're getting a Plan F, you right now have a Plan F with United, you want to go to a Plan F with Humana.
Yeah.
My first question is why? Because the benefits are exactly the same, unless Humana's premiums have gone down like crazy.
Well, can you say, I don't want it anymore?
Yes, I'm going to get to that.
Yeah, okay,
Yeah.
I guess that was my question.
Yes.
Or if you don't take it for the first couple of years and you say, I want it starting...
You seem to have that flexibility here in Massachusetts, that you can say no for now and come back later and opt for it. You can't do that in many other states.
Oh, so if you get 6 months to either get in or...
In other states.
You could never get in?
Yes, in other states, yeah. In the 5 years that I've done this, when he told me that this morning, my jaws just dropped. I'm like, really? guaranteed issue anytime. No questions asked. Okay, so in the other states where this is not the case, if you've missed that 6-month window, you can still apply. It's just not guaranteed issue. So if you have health, they can ask you health-related questions and they can either deny you or charge you more. Okay?
Can they charge you more with the guaranteed issue? Can they charge you more based on?
No. Guaranteed issue is guaranteed issue. Yeah. So you guys are in a special place when it comes to the Medicare supplement insurance, the fancy lettered insurances. And you need, in order to enroll in a supplement plan, you need to have A and B in place. So we saw A, we saw B, we saw Part D, and then we saw the supplement insurance. Any questions so far? So that, if not, I'll move on to the next section. The other alternative to help cover all those out-of-pocket expenses, the Part A deductible, the Part B 20%, and all that stuff, one was to go through Medicare supplement insurance. But that doesn't cover prescription, so you would have to get a separate prescription plan, Part D. The second option, if you look on page 5, the second half says step 2, right? Decide if you need additional coverage, and there are 2 ways to get it. Option 1 is what we just spoke about, the one in red. You get a Medicare supplement plan and a prescription plan. Now we're going to talk about option 2 in blue on the right. They're called Medicare Advantage plans, also called Part C. Why C? I still don't know, but it's C. Maybe because it's A, B, C. Right? Okay. Medicare Advantage plans are required to cover at the minimum what Medicare A and B covers, at minimum. And one of the biggest benefits of a Medicare Advantage plan is that they each have are required to have a maximum out-of-pocket per year. Remember I told you with Part B there's no upper cap, no limit, that 20% could go on and on and on. With a Medicare Advantage plan, that cap is set. It's typically $6,500 to $6,700 per year. So all your medical copays, medical co-insurances, anything that you put out of your pocket, as soon as it hits that number in any given year, after that you don't pay a single penny. The insurance company pays everything else for the rest of that year. So that is the significance of having a maximum out-of-pocket, that cap. So that's one. A lot of them will include prescription plans within them. So you don't need a separate prescription plan. They're embedded in the Medicare Advantage plan in many cases. And they range in premium from $0 per month all the way to $200 per month. And the reason they vary in premium is not, they all have to have the same category of benefits. They vary in how much they pay for each category. So a zero premium plan, for example, will have a primary care copay of $20. A $100 Medicare Advantage plan will have either a $0 or a $5 primary care copay. So they all have to cover primary care. It's how much you're paying. Similarly, this out-of-pocket maximum that I just threw out at you, the $6,700, $6,500, the zero premium plan will have maybe $6,700 as your maximum out-of-pocket because you're not paying anything per month, practically. But a premiumed plan, such as, say, a $100 plan or an $80 plan, will reduce that further. So your out-of-pocket will come down to, say, maybe $5,500. So you give some, you take some. And a majority of these Medicare Advantage plans are HMOs. Anybody not know what an HMO is? Okay, let's go through that. So HMOs are health maintenance organizations. You have to have a primary care doctor, and if you need to see a specialist, the primary care doctor will refer you to a specialist within that plan's network. So everything has to happen within that network. You do not have the ability to go see a doctor that's out of their network. I mean, you can see the doctor, nobody's going to stop you, but you will pay 100% of that cost. You don't have the option to have benefits for out of network. The other end of the spectrum is PPO, Preferred Provider Organizations. Again, they would prefer that you have a primary care, but if there's a specialist you want to see, you're welcome to go see them directly. You don't need your primary care to be referring you. Again, that specialist, if they are in the network, you pay less out of your pocket. But PPOs will let you see a doctor outside of the network with some partial benefits, usually 40–50%.
So the Advantage plans, some of them are PPOs?
There are PPOs, majority of them are HMOs. Yeah, there are PPOs.
And the HMOs, if you're traveling, how does that work?
If you're traveling, emergencies, they're required to cover no matter where you are within the country. But if you want to go spend a few months somewhere and you want to be able to have a regular doctor, that's not going to work with an HMO. Grandkids, for example, you want to go spend a few months in Florida, then you should probably get a PPO. So network, Medicare Advantage plans have a network. They include, most of them have prescription plans included in them. But these guys also provide, a majority of them will give you dental benefits, vision benefits, hearing aid benefits, gym memberships, free monthly over-the-counter supplies. So they have all these benefits that they throw in, which are called additional benefits, which are not Medicare related. They're just giving you these additional benefits for enrolling in them. Now, I'm hoping that some of you are wondering, how are they making money?
I mean, how come they're competing with the government?
Correct. So essentially what Medicare is doing is they're outsourcing your care to these private companies. And for every person that joins, say, a United Healthcare or a Humana or any of these Medicare Advantage company plans, Medicare pays, let me give you an example. Let's pick Humana. Say I enroll you in Humana, right? Now Medicare will pay Humana a fixed amount, and it's somewhere between $600 or $800, something like that. They will pay Humana that amount per person per month, and they've outsourced the care to Humana. Now, whether you fall sick, whether you use a plan, it doesn't matter, they still get paid.
So you don't need B, right?
You do need B. So for both Medicare Supplement as well as Medicare Advantage, you have to have A and B before you can do these.
So it's A plus B plus C.
Yes.
But even though C
Includes A and B in it. It's actually not A and, so it's A plus B equals C.
Correct.
but you're paying for A, you're paying for B, and you're paying for C.
A is premium free.
Okay, all right.
Right?
Well, let's just say, but
Yeah.
you're paying for B.
You're paying for,
You're paying for C.
you may or may not pay for C. There are the zero premium plans. You may not even be paying anything.
But
Yeah. No, they're not bad, trust me.
no. I'm just saying is that
Yes, if you, yeah,
it doesn't supersede B.
it doesn't. So there's B and then there's C, correct.
Yeah.
So what about the dental and vision?
The plans that do include them, they vary from plan to plan. So some of them will have a dental network that you have to go to. Some of them will say, we don't care which dentist you go to, we'll give you a fixed allowance of $300 a year. Just go see whichever dentist, submit your bills, and we'll reimburse you whatever the benefit amount is. So they all have different ways they give you the dental benefits. Same thing with vision. Now, anything inside the eye is a medical condition. That's covered by your Medicare plan. Outside the eye, like glasses and contacts, not covered by Medicare. But Medicare Advantage plans will help, some of them will help pay for those, outside the eyes. Yeah. Good?
So we are paying for, when we take Part C, we are not paying for Part A and Part B anymore, right?
B, you have to always continue to pay no matter what.
Oh, Part A and Part B, anyhow we have to pay.
if
Part A is free.
is already premium free because you've paid for it already.
Part B, we have-
So you're going to pay for Part B whether you do Medicare Supplement or Medicare Advantage. You're still paying for Part B.
I thought you said at one time that we need not take Part B if we don't want to.
If you don't have to take Part B if you have employer coverage for it.
Only in
But if you don't have any coverage, you should get Part B. Yes,
Although, and if you don't do it in that time period.
You have to do it
You get really nailed on that penalty.
the penalty.
But he's providing what B does, right? So. why-
Yes, also, but then Part B, the premium is going to the federal government. The C is going to the private insurance company.
So the private insurance companies are collecting premium from you and from the federal government here.
Yeah, and the federal government is also collecting.
That is not a premium, that's their contractual agreement between them and the federal government. Yeah.
But the
But they're making
Advantage
money twice.
They will, yes.
Yeah, they're making money twice.
Oh,
That's
yeah,
what you're
yeah.
saying,
Yeah, I'm not going to contest all
No,
that
no.
here.
That's just a fact.
Yeah, that's the fact. So well, it depends if they're taking a premium from you. Now, what if you're in a zero premium plan? Then they're not taking a premium from you, right? Now,
But if you're in a zero premium plan, can you still get dental and vision?
yes, there are some plans that do that. Yeah, there are some. So that's why all the plans vary. Yeah.
But the zero premium plans are gonna have higher deductibles and all of that.
Correct. Yes, because, yeah. So in my worldview, I call the zero premium plans as pay-as-you-go plans. So you don't pay anything per month, but if you do see a primary care, there's a copay. If you do see a specialist, there's a copay. If you get a lab, there's a copay. So as and when you use the service, you pay for it. And versus the premiumed plans where you pay the premium whether or not you use the plan. So yeah. So back to your point, they may or may not be making money off of you depending on whether you got a zero premium plan or a premium plan. Yeah, but they're making money, no doubt. So we talked about the HMO types. And then the PPO type. Is that difference clear, the HMO and the PPO? If you want to take a picture of that slide, Social Security. But this is all available online, really. Extra help. This is for those on low income. So all this while we talked about age-based Medicare, right? You can get Medicare and Medicaid at the same time. If you're over 65 and you're low income, you can get benefits of both parties. And in that case, for prescription plans, you know those copays I talked about that vary by which tier your drug falls on? There's a program, it's a federal program called Extra Help. And what that does is it reduces your, no matter which drug you're on, it reduces your copay to practically nothing or maybe $1 or something like that. So if you know someone that needs that, these are some ways to get the extra help. Also, just a general tip, whether you're on Medicare or not, one website you want to keep track of is goodrx.com. When my clients send me their list of medications and one of them throws me off, then that's where I go. And many times, I would say at least 50% of the times, and I think I shared this with you one time, I tell them don't use your insurance plan because it's cheaper through goodrx.com. So always, you know, if you have an expensive drug, I'm not saying that it'll be helpful to you every single time, but just check. I found it very useful for many clients.
So what about Canada?
I don't know what Canada.
Goodrx.com, what is it?
They're a consolidator, so they actually are able to negotiate better deals with drug companies than even Medicare is able
So you
to.
can get it at a better price.
Some of them, yeah.
Is that the same as the next one?
Yes, rxassist.org, those two websites. But I haven't used this very much, but GoodRx, I'm on it regularly.
The other thing is if you go to the drug company's websites and look up your drug, a lot of times they also have
Yeah,
plans
sliding.
where you get.
Yes, yeah, you apply for that, yeah.
Although some of them aren't applicable in Massachusetts.
So,
I have one that way.
Oh.
49 states, yes, Massachusetts won't take it.
Wow.
And it's $700 a month.
wow.
And GoodRx doesn't cover it either.
Yeah. Again, like I said, GoodRx doesn't have every single drug, but it's worth a check before you use your insurance. Yeah. What it does is because they've negotiated the prices, it'll tell you, okay, this drug at this dosage for 1 month's supply will cost you so much at Costco, so much at Rite Aid, so much at Walmart, so much is this, and then you pick which one you want. Sometimes it may be cheaper than insurance, sometimes it may not make a difference, but at least you've made a comparison and made a choice. Yes, and I have my cards here. Feel free to email questions. I'm getting familiar with the Massachusetts plans. I actually like the United Massachusetts plan.
In your experience,
Yes.
with these supplemental plans, right? If you're spending 4 to 6 months out of the state,
Mm-hmm.
right? A lot of these are local to Massachusetts companies, you know.
You're talking about Medicare Advantage.
With something like Medicare Advantage, right?
Yes.
It's like you get with, it's like you get with, here it's Fallon, or it's, you know, or it's Harvard Pilgrim, or
Tufts.
Tufts, right?
Yeah, yeah.
If you're, is it, I don't know the best way to describe it is, they're the smaller players.
Correct.
As opposed to an Aetna or a Humana or something
Correct,
like
correct,
that.
correct.
If you're spending a lot of time out of the state,
Mm-hmm.
just in general, is it better to be going with one of those big guys, or to stick with?
If you're spending a lot of time out of state, it's not a matter of big guys, small guys, it's a matter of HMO or PPO.
So,
Yeah.
say, a Tufts PPO would be equal to a Humana PPO.
PPO is a PPO, that's it. But the question is, how good is their network? How wide is their network?
How do you find that out?
But that's for an HMO, you need to know that, right?
You need to know the network for HMO and a PPO. The only difference is with a PPO, you can go out of network and get some benefit, whereas an HMO, you pay all of it.
I gotcha.
So if you're going to be out of state, definitely look into PPOs. I had my cousin call me from Florida for her mom. She lives part-time in Florida, part-time in Washington, and I said, make sure it's a PPO. So they put her on a Medicare Advantage plan, put her on an, I think, Aetna PPO. So when they come to Washington, they can see Aetna doctors in Washington. So it's not about whether it's Tufts PPO versus Humana PPO. Not the big guys versus the small guys. Is it an HMO or is it a PPO? And if it is a PPO, how wide is their network? I don't know that Tufts has a network outside of Massachusetts.
Right, that was the question. That's what I'm saying about, that's what you have to look at.
Yes, you got to look at the
The
network.
network is really where it's at.
Very
the
important.
PPO.
So your flexibility comes from access to a network, wider network. That's where your flexibility comes.
It's the same pretty much as if it's your employer insurance, HMO or PPO.
Correct, same, yeah,
thing as
same
well.
logic, yes. Same logic, correct. So here you have Tufts,
But
you have,
here you're working, not spending 6 months somewhere else.
It depends. With what I do, I may spend an entire year out of state working.
Right,
Yeah.
So you
I
definitely
always
want a
carry
PPO,
no
yeah.
matter what.
yeah.
And I'm yet to get familiar with one specific plan here, but like for example, Washington State has one plan where it's an HMO, but they have what's called a special feature where if you let them know that you're traveling out of Washington for a few weeks or months and going and staying somewhere, they send you a temporary card to use while you're there, and then when you come back, you just let them know that you've come back, and then they just reactivate your. So there are, I don't know if there's any company that does that here, but there are companies in Washington that do that. So those are, again, some things to look into. Yes.
So, suppose we are on Medicare and we travel frequently out of the country. Does any of these plans cover anything
Yes.
out of the country?
Some supplement insurance and some Medicare Advantage plans will reimburse you out-of-country travel expense, a medical expense, as long as it's an emergency. It has to be an emergency.
Yeah, but Medicare per se does not.
Medicare does not, no. Medicare does
do
not,
anything.
no.
But the plans will.
Some of them will, yeah. So if you plan to travel internationally, look at plans that offer that reimbursement benefit. And I would also pile up a travel plan along with it, a separate travel medical insurance.
So so hard to live.
So hard to live?
In your old age.
It was easier when I was working.
You know, when you, it seems to me that Medicare is a darn good deal.
Raju, the best thing is don't get sick.
Yeah, well, that's always true. That's always true. If you look on page 15, the bottom right, it talks about the penalties, the Part A, Part B. I'm just pointing you to certain pages. And there was one other page I wanted to show you. Yeah, page 13. The combination options. I'm just going to go over that one time before we close. So AB is the original Medicare. You can either get AB and just prescription plan. But if you remember, the risk with that is there is no upper limit. Or you can get A and B and a supplement plan, so no drug plan. Again, it's a risk you're taking, but it's possible. Or you get A and B and a prescription plan and a supplement plan. So this is all one set of options. Then you move on down to the Medicare Advantage. There are some Medicare Advantage plans that don't offer prescription plans, and those are applicable in some situations. But for the most part, they will include the second one, which is C will have D with it. And you can add a standalone. I wouldn't even think about it. Those are very rare circumstances, yeah. So the middle one where you get C and D is built in, that's your second option. So Medicare supplement, original Medicare plus Medicare supplement plus prescription plan. That's one set of combination. Or you get original Medicare and Part C, and that's it. Because Part C will include Part D in it. Yes?
So my question is, with all these new treatments coming, like stem cell therapy and doing stem cells, they are covered under Part D or they come under Part A?
Experimental is not covered by Medicare.
So now there's a company called Boston Stem Cell. They are making stem cells and keeping it ready in case you fall sick or you have an accident. So at that time it could be used and it could be stored. Will the insurance
I don't think so.
They won't.
Nothing, no experimental, yeah. Medicare isn't there yet. I mean, we're barely entering dental territory. Although I'm quite impressed with some plans, they've added, naturopaths. I mean, chiropractic care has been part of Medicare for a while, but now I'm seeing plans include naturopaths in their network. So they're looking at it from a preventive perspective versus a treatment perspective.
You mentioned anything outside the eye is not covered by Medicare, but inside.
Correct. Inside is medical, yeah.
Okay, so does that mean you can go see an ophthalmologist for?
Yeah, because it's like seeing a specialist. Yeah,
do that?
yeah.
Just under Medicare, you don't need a vision plan to do that.
Yes. Because that's a medical, glaucoma, retinopathy, all of those are medical conditions. Any other questions? Okay, so those of you, yes, somebody. Oh,
Yeah, great job.
thank you for coming.
Yeah.
Thank you. Thank you. The people that I didn't get the answers, can you just write it on I'll get it from you somehow, because I do want to get back to you on it. But I need your permission to get back to you, all this compliance stuff that I need to follow. So if you can fill out the permission card, and on the back of the card write your question, then I will research my answer and send you an email or however you choose to communicate. Yeah. And you had a question too, right? Correct. That it? Thank you so much.